Hey guys, I am the Nurse Doctor Asia, and this video is dedicated to helping you pass your dosage exam or dosage class. So today we will be going over calculating intravenous calculations. So let's get started. So the question says that a client is to receive 1 gram of vancomycin IV piggyback every 12 hours. The dose is diluted in 250 mLs of normal saline and is infused over 2 hours. What is the mLs per hour that the pump will be set to? So in this problem, it wants us to calculate the rate. So I like to write down to the side what my answer needs to be in, and that's mLs per hour. So mLs per hour. So the formula basically for these questions is just taking the total volume and dividing it by the time. All right, so let's go to this problem. So what is our volume in this problem? It's going to be 250 mLs. And what's the time? The time is over 2 hours. So you see how we got mLs per hour, like over here? So we good. All we have to do is divide. When you divide, you should get 125 mLs per hour. Orders 500 milligrams of cefalozolin IV piggyback every 8 hours. It is reconstituted in 100 mLs of D5W and is to infuse over 20 minutes. What is the mLs per hour that you will set the IV pump to? All right, so this one is a little bit different because we know that our answer needs to be in mLs per hour, but we see that this time they gave us our time in minutes. So we have to convert before we even start. So we need to convert 20 minutes to hours. All right, so this is how you do it. 20 minutes. And I'm a dimensional analysis girly. I'm going to set up my dimensional analysis, and I think you should too. All right, so that 20 minutes is, so minutes is on the top, so minutes need to go on the bottom. So we know that there is 60 minutes in 1 hour. So we'll do 20 times 1, that'll be 20, and 20 divided by 60. So that will give us 0.33 hours, okay? So that's gonna be the hours that we have. Now, let's go back and solve the problem. So let's go to our volume. So the question says it's reconstituted in 100 mLs. So we're gonna take 100 mLs, and we're just going to divide it now by hours, which is 0.33 hours. So we got mLs on the top, hours on the bottom. Does that match that? Yes, it does. So you divide this, and you should get 303 mLs per hour. How'd you do on that one? So let's do the next problem. It says the provider orders 750 milligrams of levofloxacin IV piggyback every 24 hours. The medication is diluted in 100 mLs of normal saline and it must infuse over 90 minutes. So what is the mLs per hour that we will set the pump to? All right, so we know that our time is in minutes when we need to convert that to hours. So I already have it on the board, but we know that 90 minutes is just an hour and a half. But I did put out the dimensional analysis in case you want to see it. So we got 1.5 hours. So now let's go back to our time, our volume. So we have 100 mLs, and we're just going to divide that by 1.5 hours. All right, once we do that division, we should get 66.7, right? So when we're dealing with the IV pump, we normally round to the nearest whole number. So this is greater than 5, so guess what? We're going to round up to 67 mLs per hour. Patient is prescribed 400 milligrams of Cipro IV piggyback every 12 hours. The dose is diluted in 250 mLs of normal saline to infuse over 2.5 mLs. So what is the mLs per hour that the pump will be set to? All right, so let's start with our volume. So we are infusing 250 mLs. And what is our time? So our time is 2.5 hours, perfect. So we don't need to do any conversion because it's already in what it needs to be in. So all we got to do is divide, and we should get 100 mLs per hour. So I hope this video was helpful in helping you calculate intravenous dosage calculations. Thanks for watching.